Good afternoon, everyone. Thank you for joining us here today for our webinar on surgical services strategy. Looks like we have a great group of people here together today, so we look forward to an engaging conversation. You can notice on the side we have the chat feature enabled. Please feel free if you have questions or comments throughout the webinar to enter them in there. And then towards the end of the presentation, we'll have a Q&A session to further explain or elaborate on any points that you guys are interested in or any other points that you'd like to bring up. Looks like we're waiting on a few more people. We'll give it just a few more minutes and appreciate your time and look forward to a great conversation. Thank you. Tom Guglielmo, our healthcare partner, who is in charge of our healthcare practice. Look forward to it. Take it away, Tom.
All right. Good afternoon, everybody. Thanks again for joining us today for this webinar. I think it'll be very educational for you. I look forward to presenting to you and obviously answering any questions towards the end of the presentation. So I'll go ahead and get started. Just wanted to start with, hold on a sec, I've got a little bit of a delay here. Okay, here we go. I just wanted to introduce Tefen to start out. I'm just going to give you a couple of slides on this, so just bear with me. And Tefen is a global management consulting firm, and really what we do is we help senior executives from multiple industries develop strategies, implement change, and generate value. The industries that we focus on are healthcare, obviously, as you can see from some of our recent healthcare clients. Also, we work in the biotech, pharmaceutical, med device, and semiconductor manufacturing industry. So we're taking principles from other industries as well as from healthcare and applying these. So as far as a little bit more about Tefen, we've been in business for 28 years. So we've been around for a while. We've worked with a lot of the Fortune 500 companies out there from all sectors. And you can see from this slide here just a couple of examples of outside of healthcare, other areas that we've worked in and other companies that we've worked in. Say a little bit about our service offerings. You can see, I'm not going to read all this to you, but it's a combination of the four areas: strategy, operations excellence, project management, and organizational development. And specifically within healthcare, we pretty much cover all the areas within healthcare, corporate and hospital level as well as departmental level. So you can see we've done a lot of work in pretty much all the spaces within the...
Hey, Darren, Jim Lee.
Hello?
Pretty good. Yourself?
Okay.
Oh, no, I figured as much. But I asked, I was wondering if there's a, capital request for a new one.
Hey, is everybody hearing that conversation?
Yeah. Yes.
I don't know what that is, but...
Yeah.
Yeah, it seems as though I think one of the participants has another line patched in through, so hopefully he'll recognize that and switch out, but I think we should be okay.
Okay. All right, so I'll continue. All right, so let's get into the presentation, and today I'll be talking about surgical services strategy. So the first thing is what are some of the challenges? I think the first thing, one of the things I've heard a lot is, we're trying to be everything to everyone. So we're offering, surgeries in all the different categories, and, is that really the best plan to move forward? Some of the other challenges that we see are lack of data. So it's really difficult to express, where should we be? Also looking at lacking suitable tools that align your strategic plan so that you actually have the information to make clear decisions. And also the external unknown. What about our competition? Are we looking at our competition and what they're doing? What are our strengths and weaknesses? And then lack of knowledge in terms of effective project management capabilities. Okay, I think we find that all over. And also from a physician side, what are our physicians looking to do? What are the strengths and weaknesses of our physician staff? Now, how do we actually overcome those challenges? Well, there's a number of ways. We've got data observation, selection, and analytical skills. One of the things that you really need to look at is that bottom-up analytical. So what is your data telling you? And really listen to that data. Also, use of decision support tools to align criteria and stakeholders to really help make those decisions. And I'll show you an example of a tool that we use called Expert Choice, and we use that in a number of ways. And then alignment of strategic and operational tools to equip your workforce for sustained action, and I'll introduce some of those as well. And then finally, change leadership and implementation plans with clear milestones to achieve those goals, and that really gets to the project management component of it. So analyzing your portfolio, okay, there's 4 main quadrants that you can see. We've got the A, B, C, D. And along the y-axis, you've got your case volume. Along the x-axis, that's your direct margin per OR minute, or you can also look at it by case. Now, when you plot the different services from the surgical services area in these 4 quadrants, you're basically going to come out with quadrant A, what we're calling the stars. So that's where we're doing a lot of case volume, and we have a high direct margin. Okay, quadrant B is an area for investment. So that's an area where we have direct margin, but our case volume is low. You know, that's an area we want to invest. How do we get our case volume to increase so that we can take advantage of that high margin? Quadrant C would be areas where you have low volume and low margin. So areas where you might want to consider divestment. You know, maybe that's not a space we want to focus on. And then finally in quadrant D, you've got your area of efficiency. So area where we're doing a lot of volume, however, our margins are low. So what can we do to help increase that margin? There might be some efficiency tools that we can implement, and I'll cover some of those in a little bit. So here's an example of, you can see that same exercise that I just talked about with actual data behind it. So you can see your A, B, C's, and D's. So in this example, you know, obviously orthopedics and general surgery would be, for my hospital, the area of my, what I call the stars. And then you can obviously look at the other 3 quadrants to see, you know, where we're doing well, where we're not doing so well. So gynecology, doing a lot of volume, there's an opportunity to push that over to the right. What can we do from an efficiency standpoint? Bottom left quadrant, ophthalmology, neurosurgery, plastics, and so we want to continue to focus in those areas. So another tool that we like to use as part of this is called the 3 C's analysis. So when we're looking at areas that we want to focus on, there's also some other components that you need to look at. Number 1 is our actual hospital, which in this case is the company. So what are our core competencies? What are the key success factors that we require to deliver what the patients want? Also looking at the patient, represented by the customer box. Who are the target segments? What are the patients seeking? And what benefits do they want? And then finally, competition. Okay, what are their target segments? What are their focuses? What can we do to differentiate ourselves from our competition? So really linking the 3 of these is important, is another important tool when looking at the quadrant. So as much as we, want to have all of our services within the A quadrant, it might not be possible depending on some of these other components. So when we look at the 4 quadrants, okay, in order to move our direct margin, which is the x-axis, that's really competency-driven, and I'll talk a little bit more about that. And then finally, on the case volume, that's more customer-driven. How do we get more cases? I mean, it's not just that, okay, yes, we want to increase our volume, but how do we do that? So in order to move to the right, it's really about the efficiency, and then, of course, going up is about the volume, and how do we go about doing that? So from a customer standpoint, some different options that you can consider to try and drive up that volume is adding physicians, okay? Looking for, recruiting other physicians to bring in some of the capabilities to increase the volume of those high profitable areas. Also, how do we attract new patients? We can look within the current population, the demographic that we have. How can we bring new customers over? What can we do as a hospital to either market that or make changes to our current operations? Mapping clinical pathways to retain customers. So understanding disease progression, developing customer marketing retention strategies, understanding the local community and what they're looking for. And then finally, differentiation strategy or centers of excellence. So developing these centers of excellence, like I showed in the example earlier, orthopedics, maybe that's the area that we should focus on. We want to be the best in the area when it comes to orthopedics. When you look at competency-driven, this gets into the efficiency efficiency piece. So OR key levers. How do we increase our availability? How do we improve capacity? How do we balance between inpatient and outpatient? What's the case mix? What does the case mix look like? And then from a revenue collection standpoint, ensuring that we're capturing all the revenue possible. And then also key success factor adherence. So adherence to those success factors over that 5-year period that we have, our strategic planning processes, that's aligned with our metrics. And then finally, resources and assets. Do we have the right resources to actually make this happen? Okay? Aligning our quality indicators. Obviously, core measures are a big component today. Aligning to those key operational factors, length of stay, on-time start. Okay, making sure we're doing the right things so that we have the capacity to bring in that additional volume. So 4 key strategic levers. And when you're looking at how do we move forward? So you've got site-specific versus system-wide. Okay, do we have something that we can do at a site versus do we need to necessarily do it at the system level? Looking at your IT systems and your patient database, really that's the knowledge management component. Leadership. So what is is the leadership aligned? Is there good communication? And do we have a vision and a clear goal for the organization to move forward? And then finally, do we have a clear strategic plan? Okay, that's very important. And then the 4 key operational levers. Okay, there's efficiency, which impacts your OR minutes available. Then there's the availability, so that's impacting your volume. Then there's that balance, as I said, between outpatient and inpatient. So, can we move some of the surgeries that we're doing in our inpatient unit to the outpatient to create more availability? And then finally, the case mix, which will actually impact our overall strategy and revenue. And we'll show you a little bit, a couple of models here shortly that take into consideration our case mix. So when you look at efficiency in the current state, this is just an example of a dashboard. You can see that it's looking at first case on-time start and what the room turnaround should be. So for the efficiency lever, we really want to look at patient pre-admission testing completeness. Are we getting all of what we need to get done prior to the day of surgery, which will obviously impact our on-time start? How are our turnaround times? What are the reasons for our delays? And then scheduled versus actual time. Are we actually adhering to what we're scheduled? All right, so these are all components that impact the efficiency and the operation of the surgical services unit. So just some examples. Okay, this is on-time start, of course. This is an analysis that is really important to look at. I'm not going to go into the details of each chart, but it's really more for example purposes. You can see that the impact of if we're able to improve a certain percentage, what that's going to mean to our capacity. And you can see it's going to be different by day of week. Unfortunately, it'd be nice if we could have the same volume going Monday through Friday, but as you know, that's not realistic. So there might be certain days of the week that are more problematic than others. This is also taking it to another level. So looking at on-time start by surgeon and by service line. We might be, overall, we might be at 80%, but there might be certain physicians that are much lower than that. There might be certain service lines that are also lower than that we want to focus on. Okay, waiting time. So this is looking at how much time is the patient waiting in the room before the surgery starts. In some cases, you have patient in room. That might be your metric. You may be doing a really good job at that, but the surgery may start 30 minutes after the patient's in the room. But technically, we're really starting on time. It really depends on how you measure that. I think that's another question to ask is, how do you measure on-time start? I've seen a lot of different ways. There's patient in room with, 15-minute grace. There's cut time. It's really all over the place. But, our belief is that cut time is really the true on-time start. Okay. Here we're looking at your scheduled time versus your actual time. So again, if we're scheduling 2 hours for the procedure, are we taking 2 hours? Are we taking 1 hour? Are we taking 3 hours? What's the variability within that service? And, that's really important to track. I know that most hospitals do a good job of actually looking at this, but, again, you're only looking at the last 10 cases and making a determination from that. So trying to reduce some of that variation in the schedule versus actual is critical to increasing your efficiency and opening up